Hello, my name is Yvonne Brooks from Veteran to Veteran Info LLC. I'm a 100% disabled veteran, and I'm also an accredited claims agent with the Department of Veteran Affairs. I know a lot of the insides and outs of the VA system that most veterans don't know. So I'm creating this YouTube channel to help veterans get the benefits that they deserve. Today is a topic I'm going to talk about. It's called military sexual trauma. There's a lot of military sexual trauma that goes on in the military, and a lot of people think that they have to suffer with those symptoms without getting the benefits that they deserve due to their disabilities, but that's not the case. You are eligible for the benefits that for the disabilities that occurred to you during military service. Military sexual trauma is referred to as MST. MST can result from a military sexual assault or a sexual harassment. It doesn't mean they actually had to assault you. You can always also experience sexual harassment and be eligible for sexual assault. As a claim agent, I've done many claims dealing with military sexual assault. There's a lot of people that go on years, especially like in the early 80s and 90s. There was a lot of the good old boy system, and people didn't get in trouble for the things that they did to other service members, whether it be male or female, because there's also a lot of military sexual trauma that happens to males as well. And they never spoke about it because of the shame that comes from being sexually assaulted, and you're afraid to say something because you were scared of the reprisals that may come after you report somebody during those times. And still to this date, there's people that are younger soldiers that are harassed or being taken advantage by upper echelon seasoned personnel, and they're afraid to speak up on their behalf. But I want to let you know that you can be compensated for the things that you had to deal with during military service. I've done claims where I've had a private that went to Germany, and then it was actually her commanding officer that was sexually harassing her. And because she didn't want to go with his advances and she started dealing with someone else in the unit, he made it his mission to make sure that she got put out of the Army. Every little thing that she did, they made up counseling statements. He tried to give her Article 15s that got overturned by the JAG office. He even went so far as when she was on maternity leave to put her in for a chapter. He made up a bogus, backdated disciplinary actions for counseling statements. After I went through her records with a fine-tooth comb, it was easier to see that he was trying to set her up for failure. She requested to get out on a pregnancy discharge. He would not allow her out because that was his mission, because she didn't do what he wanted her to do, to put her out of the Army at only 20 years old. Well, she was 19 when she got there. By the time he got through with the chapter, it took him around, I guess, no longer than 18 months from the time she got to the unit for him to make this whole scenario up as if she was a bad soldier in order to get her taken out of the Army. And after the second time that he gave her Article 15, at that point she just gave up. She didn't want to be in the Army anymore. And after the constant harassment, and when she went in his office and slammed her hand on the table, he tried to give her Article 18 for that. But he truly harassed her to the point that she almost had a nervous breakdown even while she was pregnant. He continued the harassment. And after I went through her records and seen everything that he did, he gave her a other than honorable discharge. Not honorable, but other honorable than discharge, which impacted her life because she was not able to get certain jobs because her discharge didn't say honorable discharge. And that someone that's only 20 years old, for you to do something like that to follow them for the rest of their life because they didn't go with your advances, is just cruel. And I was able to go through her records and go line by line from the time that she got there to all of the offenses that he charged her with, which was untrue. I went to the Department of Defense and asked for upgrading her discharge, which after all of the proof that I showed line by line, he even had his NCOs to give her a weight weight taping, even though she was not overweight at all. But when I looked at her wait list, the person didn't even mark anything on the list. He just put her name on there. But that was just further forms of harassment. And she said he was like touching her hips and making sexual comments to her. So it wasn't only the commander, but he also enlisted other members of the unit to try to further harass her and bring her to almost a nervous breakdown. And I went through that record with a fine-tooth comb and pointed out all of the infractions that occurred to this young soldier. And it went up to the Board of Department of Defense. And after they reviewed all the evidence that I highlighted in her records, they changed her discharge and gave her honorable discharge under honorable conditions. And after she got her evaluation, when I pointed out all the things that occurred to her in the military and the effects of what the maltreatment and harassment during active duty caused on her life, I was able to get her 100% on PTSD alone for the traumatic events that caused in her life after that terrible treatment she got from her commander in the military. And there's thousands of veterans that also suffer with that type of treatment after being in the military. They were too afraid to say anything, and they sometimes, when those things occur to you, you end up getting out the military early, or you're getting chaptered, or once you get out, you may turn to drugs or alcohol. But if you suffer from MST, all VAs have a military sexual trauma coordinator at every medical facility, and you can assess them for care. You don't even have to have a rating for PTSD due to MST in order to get the counseling that is available to you at the Department of Veteran Affairs. They have MST outpatient services performed by referral from community care, where if they don't have any space at the VA office, they will contract with civilian companies to have you get the care and the psychotherapy treatment that is necessary. The mental health services included psychological assessments, medication, evaluation, individual and group psychotherapy, and associated with MST, depression, PTSD, and substance abuse. In order to claim PTSD, the VA uses a regulation called 38 CFR Part 4, Subpart B. That's the VA Bible. And that's what VA uses to determine what they give you for each disability. It's very important before you go to any VA exam that you review that 38 CFR. When you look at the 38 CFR for PTSD, mental health, it doesn't matter what the disability is. As far as mental health is concerned, it could be MST, PTSD, depression, anxiety, bipolar, schizophrenia, mood disorder, mood adjustment. All of the mental health disabilities fall under one criteria. They diagnose you for the reason you have the mental condition, but the way that they rate you is based on how it impacts your life. And if you look at that 38 CFR Part 4, Subpart B, it's going to tell you how the VA rates you according to severity of your symptoms. They rate you from 0, 10, 30, 50, 70, and 100%. Therefore, you must look at the criteria for each of those levels of disabilities, and then you're going to decide based on the description of where you may fall at as far as those symptoms are concerned. After you look at that, you're going to do a statement of support. A statement of support is very important so that you can tell the rater in your words exactly how that disability started and how it continues to impact your life. And in addition to services of the DoD reports, there's other things that you can use to show that that condition happened, even if you didn't report that you had some military sexual trauma in the military. Some of the things you can get a letter from your, or just a statement of support from your clergyman to say that he have counseled you about the problems that you are having dealing with the sexual assault that you experienced during the military. There's other counsel facilities or health clinics that you may be seeing outside of the VA that can help substantiate that the fact that you are receiving services due to PTSD caused by your time in the military. You may even be going to a rape crisis center or a center for domestic abuse due to the military sexual trauma that you've had in the military. Often people don't realize spouses are abused by their husband. They may be even raped by your husband or experience sexual trauma and abuse. I've done claims where a soldier was sexually abused by her husband. She was physically abused by her husband, and I was able to get her 100% for her combined disabilities due to the physical abuse that she sustained by him throwing her different ways and fighting her, which she ended up getting a TBI, a traumatic brain injury, and also it caused her to have problems with her neck, her back, her lower back, her upper back, that caused other disabilities besides the mental abuse that she suffered under his hands. And even when she reported the abuse to his commander, because her husband wasn't in the same unit, they just slapped him on the hand and didn't do anything to him. So she ended up not staying in the military over 3 years because she was fighting for herself. Even though she reported it to the MPs, she reported it to her commander. She did everything that she needed to do as a soldier to try to be proactive and try to stop the abuse. But the command during that time didn't do anything to help her. And she feared for her life that if she didn't get out of the military and get away from her husband, that he would end up killing her. So she ended up having to get out the Army early, but she requested to get out the Army early because she didn't feel protected. She didn't feel safe. So it's very important to know that if you go through these things, and this happened over 20 years ago, and she didn't get any help with these issues. And when I talked to her and then I looked through her records and I realized that she was a victim of not only a military sexual trauma, but domestic abuse as well combined, that I was able to prove that the abuse started during the military and that it caused her a lot of mental distress throughout the years that continued to impact her life and the way that she was able to live. And I was able to also get her 100% disability rating. So please don't think just because you never told anyone about it that you're not going to be able to get compensation or counseling for your abuse. You can also go to any civilian police reports that you may have gotten due to your abuse in the military. That could be used as served as military sexual trauma markers, because there's a lot of different markers that the VA uses to help determine if you have enough evidence to establish that you had MST in the military. Some of the things that you can use are if you were in the military, then all of a sudden, because of this military sexual trauma, you didn't know what else to do, and so your work ethics changed. You started getting in trouble at your job because you didn't know how to control your emotions or deal with your emotions, and everything triggered you. You may had to be changing work performance at that time. You started to have anxiety and panic attacks and depression. Even if you were sexually attacked, you may have started to go to sick call a lot and get pregnancy tests to make sure that you weren't pregnant, or get an STD test because you were afraid that you may have gotten an STD from your violator. Your relationships may have suffered after that military sexual trauma. You may not been able to communicate with your spouse or your boyfriend, which may later on, years down the road, ended up you having to get a divorce because your significant other couldn't deal with the trauma that you were carrying into that relationship, which was not due to yourself, but was due to what happened to you in the military. While you were in the military, you may have requested to transfer from another military company to another one because of the harassment or the disrespect or the assaults that were happening in the current company that you are at. So perhaps maybe you got transferred to another unit because you couldn't deal with being in that unit any further. And sometimes the easier way to just, it was easier to send you to another company rather than deal with the abuser that was in your company. And I've seen that happen a lot in my 20 years of service. Instead of dealing with the person that was causing this trauma to a veteran, they let that person stay in the unit and sent that other person to another unit. Also, due to military sexual trauma, you may have sexual dysfunction. There's something called female sexual arousal disorder, which is equivalent to a man having erectile dysfunction. Due to military sexual trauma, veterans often have FSAD if you're a female, and if you're a man, you may start to have erectile dysfunction, which is rated separately from the military sexual trauma, which they don't give you a rating for FSAD or ED, but they will give you $110 extra a month for your military sexual trauma, erectile dysfunction, or female sexual arousal disorder. A lot of people that have experienced that type of abuse in the military also end up trying to cover their trauma with alcohol or substance abuse. A lot of people that are a victim of military sexual trauma end up using all types of drugs trying to hide the pain and cover the abuse that they once went under. Unexplained social economic behavior. You may not be able to maintain a job because of the triggers, or a male-dominated or female-dominated organization. And sometimes there are certain triggers that if a man comes too close to you or says something inappropriate, even though it has nothing to do with him, it can trigger you and send you into a panic attack. So there's all kind of things that are going on with you that you may not be able to understand that is as a result of that military sexual trauma. I've also done cases when there are just as many men get military sexual assaulted in the military as there is females. I've done several cases when there are males that have been drinking or get into a situation where they're hanging out with a lot of their buddies. And sometimes you may not know. There are people that know that if they get you intoxicated and you're not able to stand up for yourself, they can take advantage of you. And that has happened to a lot of males, have been taken advantage and been raped by other soldiers. And they were too ashamed of the fact to say something, that they got themselves in that situation. And it's not even that they put themselves in that situation, that somebody was a predator. And that's what it was. There are a lot of predators in the military, and they look for things like that to get you intoxicated, to get you in situations where you're not able to defend yourself, to take advantage of you. And that is not due to your fault at all. And a lot of people feel guilty, say, well, maybe it was my fault because I was drinking. It's never your fault if somebody harms you. When you tell somebody no, no means no. And it doesn't matter if you were drinking or what was going on, that if you did not consent to that sexual advances, then that means that they did something to you that you did not allow, and they should be reported. If you're still active duty now, if there's something going on in your unit, if you're being, somebody's touching you inappropriately, or they're harassing you, giving you cat calls, or anything, if somebody says that they can get you special favors if you do this or if you do that. And a lot of younger soldiers, they can be easily convinced to do things that they shouldn't do because somebody that was higher ranking than them told them, if you do this, I can make sure that you will get this special favor or get that special favor. But you shouldn't fall for any of those tricks about what people say they can do for you, because what they're going to do is cause you to have a lot of military sexual trauma in the future in your life. And there's a lot of recent improvements to the VA claims, because before they were disapproving a lot of military sexual trauma, but now they have specific people that only handle military sexual trauma claims. So if you experience military sexual trauma, when you fill out your initial claim form, which is a 21-526 Echo Zulu, you're going to put on there PTSD due to MST. And then if you have any of those buddy letters from family or friends, even if you didn't tell your commander, you didn't report them to JAG or to the police officer, you may have confided in a family member or a friend that can write you a statement of support, which is a VA form 21-4138 that can confirm that you had told them during that time frame what was going on in your life, the military sexual trauma and the harassment that you were experiencing during active duty. And that will also help substantiate your case that did happen, that did happen, even if you didn't report it to your chain of command or to the police. And now, the more statements that you have besides your own statement, or those things like I stated, the STD, going to sick call to get STD tests, you getting the pregnancy test, that your life had changed, you started using alcohol or drugs, or you started getting in trouble, or you isolated yourself and you don't have any family or friends, and you have depression and anxiety. All of those things are symptoms of, if you can't hold down a job and you can't maintain relationships, all of those are symptoms of military sexual trauma. And there's recent improvements to the VA claim process, and the VA made this statement: in an effort to continually improve our services to veterans, VA has made several recent changes to improve how MST-related claims are processed and decided. VA now provides special training to staff who work on MST-related claims. This is to make sure they have specialized knowledge needed to evaluate these claims properly. If you filed for an MST-related claim before August 2018 and received a denial, VA encourages you to refile so that your claim can be reviewed by staff who have received this training. You can request a reevaluation by contacting the MST Outreach Coordinator at your local VA regional office or by going online. There's VSOs and MST Outreach Coordinators and other VA staff can help you with submitting your claim. But please, whatever you do, if you are suffering with MST due to your military service, it doesn't matter if this incident happened 10 years ago, 20 years ago, and if they have ever denied your claim, I hope that you will go back to the VA and reopen that claim for a previous denial. If you're going to reopen the claim, it must be on a supplemental claim. That's going to be on a VA form 20-0995. And you're going to do your statement of support explaining all the things that happened to you due to that assault. You're going to look at the MST markers that the VA uses to help establish if you are an MST victim. And even if you don't have enough evidence to get rated for the MST, you are still eligible to get counseling and medication and therapy through the VA for your military sexual trauma. But if you follow the directions that I've given you on this video to help establish your claim, I'm quite sure you'll be very successful in getting your PTSD due to MST disability rated. And as I stated, I have a veteran to veteran info page on Facebook, which I have over almost 700,000 followers on that page. I've had that page for at least 6 years now. That there's thousands and thousands of veterans that due to this page has been able to get 100% disability ratings because of the information that we all share collectively in that group to help one another to get the benefits that you deserve. So please, I ask of you, if you ever experience any type of military sexual trauma, please get counseling and please put in a claim to get the benefits that you deserve. Please follow these videos that I post on this YouTube channel for other disability information that will be helpful to veterans. And it's been a pleasure giving you information that may be very helpful to you in the future. And please subscribe to this channel for future videos. Take care and God bless.